Well, as we heard a little earlier, the COVID-19 vaccine rollout is being spearheaded by national government, but it will be all hands on deck to get vaccines into arms across South Africa. The private healthcare sector also has a crucial role to play. Medical schemes will also play an important role in communicating with their members efficiently. The government employees medical scheme looks after the medical needs of about 700,000 public servants and their families. And today, GEMS held a symposium on the vaccine rollout challenges. Let's speak now to the principal officer at GEMS, Dr. Stanley Moloabi. Good evening, Doctor, and I believe you've just had your vaccination, which is wonderful news. As a healthcare worker, I'm sure it must be quite a relief. You held a symposium today about a government's plan to get vaccines into everyone's arms. What are you hearing about the targets for daily injections? Because we've seen an increase in recent days under Sisonke. We've seen about 30,000, I think, in the last 24 hours. What is government saying about how quickly they can ramp up injections?
Good evening, Sally, and good evening to the eNCA viewers. Indeed, I'm actually sitting at one of the vaccination sites, Mediclinic Medforum, where I've just received my vaccine. Yes, it's been a long wait. And there's always a sense of relief, but we obviously must wait to develop immunity against the vaccine. So it has been an experience. I arrived here about 2 hours earlier and was in the queue, made it into this interview. So the question that you really are asking is, what should we anticipate in terms of the numbers on a daily basis? So the information that was shared at the symposium earlier today was that the rate limiting step, and Dr. Amban Pillay spoke on behalf of the Health Ministry. He indicated and said that the rate limiting step really will be the supply of vaccines. And as the vaccines arrive, they have to be dispatched to the various vaccination sites. So in terms of those numbers that are being anticipated, we will depend largely on the availability as the supply comes in. He did show that we are having, I think, about 2 batches of vaccines that have been received, in the Pfizer ones, and then the Johnson & Johnson ones. There is a big batch that is being expected, hopefully before we start the second phase on the 17th of May, which is next week, Monday.
All right, so bearing in mind that there are about 5.5 million elderly people, and government set a target of about 45 days till the end of June to try and vaccinate almost all of them, that would mean that we'd need to be doing about 120,000 jabs a day, every day, from Monday. Did any of those figures come up as doable? Were there any sort of plans on how quickly they can ramp up?
Yeah, so I think there's a lot of modeling, and remember, we also participate as GEMS in some of the planning meetings and those numbers are being crunched in the various setups of meetings that you're involved in. And I think the aim when everything really has been achieved in terms of setting up is around 200,000 vaccines per day. So if we can achieve that, then we should have the rollout, being done within the projected timelines. We do also know that when you start something as big as this, at the beginning, you can't run from 0 to 100 kilometers per hour immediately. So everything will be stepped up from Monday as we, become more experienced in rolling out. At the moment, based on the planning, we have in excess of about 3,000 vaccination sites that have been accredited. However, it was shown at the symposium that number should increase for us to achieve the timelines that we have set for ourselves.
It was quite interesting listening to Keith Clutie from the Western Cape earlier. He's saying that eventually we're going to see small pharmacies and clinics all giving out these vaccines under this national plan. I wanted to ask you specifically, what is the role of the private medical aids? If I think of GEMS, obviously a lot of your people, a lot of your clients are healthcare workers. They would have probably received their jabs already. But of course, a lot of your civil servants are probably eagerly awaiting information, and I'm sure that quite a few of your members are over 60. What role do you play in facilitating their experience? Are you helping them interface with the website, or do you just allow all your members to go through the government website and they take it from there? I'm just trying to understand what is the role of a medical aid scheme here.
Yeah, so the role of GEMS as a government employees medical scheme is that we will assist government. Government is the employer of public service employees, and we will assist in the rollout of the vaccine within public sector employees. So we cover, as you indicated, the number is actually just over 750 public service employees, and that includes some of them who are pensioners. So then we know that the number of public service employees is said to be around 1.3 million. So some public service employees belong to other medical schemes, but the majority are with GEMS. And we may still have, maybe there will be some of them who may not be insured. The role of GEMS will be mainly to assist government in the logistics relating to the vaccination of public service employees. The role of all medical schemes will be to ensure that the vaccine healthcare cost, which is the professional fee, and the cost of the vaccine are paid for by the medical schemes as a prescribed minimum benefit. And some other medical schemes may be having their other old programs that I'm not privy to, and I'm only talking on behalf of GEMS.
All right, so speaking on behalf of GEMS, will your people have to pay for the jab, or does it come out of their medical savings? And any truth to the stories that if you're a private medical scheme participant, you'll also actually be charged for a jab for someone else who's not in private?
No. Medical schemes, so if you are covered by any of the medical schemes that are registered in South Africa, you are not supposed to pay anything towards the cost of COVID disease. And what I mean, including hospitalization, going to the doctor, as long as the diagnosis is COVID-19, it must be covered as a PMB. So none of the payments must come out of your savings, even from the medical scheme. All of this must be paid from what we call risk. And what that simply means that it should not affect your day-to-day benefits. And there should not be any co-payments or out-of-pocket payments, including for the vaccine. So that is what the law says. So anybody who's covered by a medical scheme, the medical scheme should pay for the vaccine itself.
All right. Thank you so much for chatting to us this evening. That was the Principal Officer at the Government Employees Medical Scheme, Dr. Stanley Moloabi.